This segment of Delmarva Life is brought to you by Peninsula Home Care.
This is Jack Fisher from Seaford. Jack is a perfect example of how home health care can help you get back on your feet and back to your life. After being released from the hospital, he leaned on Peninsula Home Care to help him complete his recovery and the comfort of his own home. If it wasn't for their exceptional care, he says he may not have hit an important milestone.
They found fluid, and they called my doctor, and he put me back on Lasix. And if they hadn't done that, who knows? Maybe I wouldn't have had no 80th birthday to celebrate with my friends and family.
This was Jack's second time using Peninsula Home Care. He says they helped him understand what he could do on his own to get better, which ultimately led to him getting his life back. Well, many of us could find ourselves in a similar situation. Perhaps it's not you who needs the care, but a loved one who is being released from the hospital after an illness or injury. Sure, it's great to have them home, but are you prepared to give them the care they need? Think about it. It can be overwhelming to have all of that fall on your shoulders. Well, you don't have to do it alone. Joining us today to tell us more is Robin Kokenauer, Branch Director for Peninsula Home Care at Nanticoke. Thanks for joining us this afternoon.
Thank you.
So first of all, just tell us, we're talking about home care. What is offered for these families?
Right, we offer in-home skilled care, so nursing, skilled nursing care, physical therapy, occupational therapy. We have home health aid services. We come directly to the home and we're able to transition them from out of the hospital or out of the facility to get them back to that previous level of function they were enjoying before their illness.
Right, and if families were looking into home health care, what do they need to know before going through the process?
Sure, you need to make sure that you pick an agency that is Medicare certified. Find out how long they've been in business. You want to make sure that the agency provides the services that you're looking for. So for example, if you're a congestive heart failure patient, you're frequently in and out of the hospital, you want to pick up an agency that has a good program that's going to teach you about your meds and your medication and management of your disease so you don't end up back in the hospital.
But your work doesn't stop there. I mean, you still need to be involved. The caregiver and the doctors and the patient all need to work together?
Absolutely. We work under the direction of a physician for everything that we do, and we directly involve patients and their caregivers in the plan to make sure that the goals for our care are their goals. We want to make sure they're realistic and something that is going to benefit the patient themselves.
Everybody on the same page.
Yes.
It's also important the agency is Medicare certified?
Yes, it's very important that we're Medicare certified so we're able to provide the skilled services, the wound care, the IV therapy, those kind of things. Agencies that aren't Medicare certified just provide custodial care or sitting services. So if you need a nurse or physical therapy, then you have to look for an agency that's able to provide that.
Well, what if I have an insurance other than Medicare?
Right. So you want to check with your insurance provider. Make sure that the agency that you pick is participating in your program. And you can call the agency, and we all know who we're participating with and who we're not, and we can let you know. Sometimes we do take patients and we just inform them what the copay would be, but it's always best to find someone who's participating so you don't have that additional money to pay.
And participating is a key word there.
It is. It absolutely is. You want to make sure that they are in network or participating with your insurance provider.
All right, and it's very easy to shop for home health care and compare agencies, isn't it?
It is, and you can go online to medicare.gov/home health compare, and you can look, you can actually just type in your zip code, and all the different agencies will come up, and you can do a comparison side by side of what our outcomes are, what our rehospitalization rates are, and make an informed decision for yourself.
That is great, and it's so important too. Thank you so much.
Thank you.
Robin, for
Thanks
joining
very
us
much.
today.
Thank
and
you.
to read more about services provided by Peninsula Home Care, go to WBOC.com and click on our picture at the top of the page. Now let's talk about the other members of our family. You know, the ones with 4 legs and covered in fur. Despite the love they can bring to our lives, did you ever think they could make you sick too? Up next on Delmarva Life, we're talking pet to human infections, and it goes far beyond cats and dogs. Hear how sickness spreads and what you can do about it. And our pets can also land us in legal trouble, and not just if they bite someone. We're learning how else they can cause liability and steps you can take to avoid landing yourself in trouble with the law. But first, we've been talking about being overwhelmed when it comes to caring for a loved one. Dr. Oz says, don't let the anxiety of it all get you down.
Hi, I'm Dr. Oz. If anxiety is holding you back, try these tips to conquer it. Identifying your anxiety triggers by keeping a journal can help you spot patterns. Then, set aside several minutes each day to actually worry about them. Outside of that time, no worrying allowed. And if you need more help, consider speaking to a licensed therapist.